To begin, let's identify what a sputum, also referred to as phlegm, is. It is identified as a thick, opaque color type of mucus secreted by cells in the lower airways, bronchi, and bronchioles of the respiratory tract. Sputum can cause difficulty in breathing and can result in excessive coughing. It is not the same as spit or saliva, which is produced higher up in the mouth. Sputum contains cells from the immune system, which help fight the bacteria, fungi, or other foreign substances in your lungs or airways. The thickness of the sputum helps trap the foreign material. It may include foreign material from air pollution, smoking, as well as bacteria from infection, or blood due to cancer, airway damage, or pulmonary edema. To assist in medical diagnosis, the sputum is inspected both coarsely and microscopically. Numerous cells and molecules, including soluble and insoluble lipids, fatty, waxy, or oily compounds, are present in the sputum. The study of the patient's sputum uses an analytical method to look into the acellular and cellular elements that were ejected from a patient's upper respiratory tract. This procedure is essential in the evaluation and management of lower respiratory infections or other long-standing health conditions. Now let's dive into learning more about the sputum culture test.
So what is sputum analysis? Sputum analysis is a simple test that checks for bacteria or another type of organism that may be causing an infection in your lungs or the airways leading to the lungs. The test is performed in a very simple manner. The first step is that the patient needs to cough deeply into a container to release any phlegm. The second step is that the container is sent to a lab and a sample is taken from the container and placed in a special dish. Lastly, the dish is observed for 2 to 3 days to see if any bacteria grows. Sputum analysis is very beneficial and can detect a variety of different diseases such as tuberculosis, cystic fibrosis, asthma, NTM lung disease, and more.
Through cooperative fundamental and clinical studies, the Firestone Institute for Respiratory Health carries out research to better understand respiratory health and illness with the goal of enhancing patient treatment. The research is diverse and includes clinical trials and epidemiological studies like the Canadian Health Infant Longitudinal Development Study, Bird Cohort Study, for which the Firestone Institute for Respiratory Health is hosting the coordinating center, as well as fundamental studies of animal models of lung disease such as asthma, COPD, and fibrosis.